Well, this is a very interesting show that we have for you today. If you were with us last week, Doctor, we got your personal story about life in Syria and then being able to come here. But Asma, at the end, as you told people, both of our guests here today, who you're going to introduce in just a moment, got together in a car, started talking with one another, and out of that conversation, we should point out, talking to one another after being on your radio show.
Right.
And out of that conversation has come a fantastic new initiative that's going to help a lot of people. And I'll let you pick up the story.
I'll add more details to that story. You know, I was presenting for an Enjoying Good presentation at WPI. And that's where I met Dr. Rick Wobbe, who was a former exec for an R&D company. And what happened was, after my presentation, we ended up talking and went out to lunch one day, and he actually said that he wanted to help out with Enjoying Good and said, please tell me how I can help out. And at that time, I was really busy. There was another Enjoying Good event that was coming up, and I needed someone to give Dr. Ihsan, Kadaan, a ride from Boston towards Worcester area. And all I could think of was, wait a second, I just had someone volunteer. So, and I felt very guilty because I know Dr. Wobbe is so, you know, has so many credentials, and I felt very guilty asking him to be a driver.
And we're going to meet our guest in just a moment. I do just want to set up that I think that if people don't know, Asma is one of the people in the world who, when she calls, you do not say no. You are one of those people that things happen and you make things happen.
Well,
so the fact that you would even admit to, I felt guilty. I'm thinking for maybe 10 or 15 seconds.
No, I did because I felt, I hope he did not think that I don't realize all his credentials and all the great work he does. But I said, you know, he volunteered, let me just give it a try. Called him up and I said, I really need you to do something for me if you could. He wanted to help out. I need someone to drive a guest of mine to Holden and towards Worcester area for another presentation. And I thought at that time, you know, with a great story, let's have him on the radio show. And he very graciously volunteered to also drive him back to Boston. And that day is when they started talking. And this great initiative came about. So thank you for joining us. Both are doctors in different fields, but doctors nonetheless. And if you can just give us an idea of what that conversation was like in the car that triggered this.
Oh, sure. Well, thank you very much, Asma, both for having us on to talk about what we've done and also for that opportunity just about a year ago
yes.
now, to get involved in this. If I can go back just a little bit before that, I think we're all familiar with the 2016 election and all the things that happened there. And for me personally, it was sort of a moment to look in the mirror and say, well, what have I done? Not that made this happen, but allowed so much of the racism and the xenophobia to happen. And through my scientific career, by the way, I'm a doctor, but it's a PhD, not an MD, in biochemistry. But throughout my training as a scientist, I had come to depend on people from all over the world to help me learn what I needed to do. And I could not have been successful without that kind of assistance. And so I feel, perhaps without traveling much, already like a citizen of the world through this support. So at that point then, I became specifically very interested in working with people from the Islamic world and began talking with you, as you said. So what happened on that fateful day was I had picked up Dr. Kadaan, and I have to say, by the way, Ihsan, I expected to find a very old man with a long beard and gray hair, quite distinguished. You are quite distinguished, but none of the other things happened. Not that so it was a very pleasant conversation, and then I stayed to listen to Dr. Kadaan give his presentation about the healthcare situation in Syria. And one event that I'll never forget that he talked about was listing the major causes of death and disability in Syria. And very close to the top of that list was diabetes. Now, part of my research background in the pharmaceutical industry involved working on treatments for diabetes. And so I was pretty familiar with where diabetes stands in the list of things that should cause serious disabilities and death. And it's not as high as it was in Syria. And by and large, diabetes is a controllable disease. So I was appalled that that could be the case. And of course, appealing to my scientist background, it's a problem that must be solved. So during that time, then Ihsan, as I was giving him a ride both to your interview and then back, we got to talking about that. He explained more to me about how the situation came to be in Syria. And I just heard more and more things. And then eventually we started talking about, well, maybe I have some connections based on my past experience that can help us with getting the needed medications to Syria. But I think I should let the good medical doctor describe a little bit about the diabetes background in Syria.
Sure. So, I mean, it's, as Rick said, like, it was a great challenge in Syria. And the reason for that, we didn't have, I mean, we ran out of insulin because of the insulin shortage. And there were, like, different reasons for that. One of the most important reasons, one of the pharmaceutical company in Syria used to produce insulin. But because of the war, the infrastructure of that factory and that company was distracted, so they were not able to produce insulin anymore. The second reason of that, as you know, insulin needs to be saved in low temperature environment. And since in Syria we didn't have electricity, so we were not able to save the insulin in refrigerators. So most of the insulin we saved was destroyed, and that again, you know, increased the problem. So, you know, we used to receive patients to the hospital and to that NGO I was working in with diabetes, and we didn't have insulin to give them. So they their blood glucose go very high, and you know there are a lot of complications related to diabetes. So, you know, as Rick said, I was invited to that talk in one of the churches here in Massachusetts, and I explained about my experience, including this problem, and then, you know, listed all the health problems, you know, including the diabetes. And when I finished from that talk, Rick and I in the car, we talked about, okay, we need to find a solution for this problem. And then since that time, as he said, like a year ago, we started this initiative.
I do remember one, I believe, fact that you had said was that in Aleppo there was a factory that did make the insulin, but the only reason that the insulin couldn't be given out was because of the refrigeration problem. I think that's what stuck with me when I was hearing that the solution and cure, or not cure, but what to maintain and not have so many deaths is right there.
Yeah,
but because of just electricity, they weren't able to preserve that medicine.
Well, in fact, as we started to investigate this, we found out that that was only a small part of all the problems, as it turns out. First of all, just by way of background, I think it's fair to say that prior to the conflict, Syria had a healthcare system which would be the envy of many communities here in the United States. If you needed insulin or these other drugs for diabetes, you got it. They manufactured it in country. But anyway, it wasn't just that the infrastructure, the electricity wasn't there. Also, the methods of simply delivering the drugs were now affected because your trucks can't drive on the roads under a rocket attack. But even worse was that the factory itself was damaged during the Civil War. So there's been much talk of hospitals being damaged. Well, in fact, the source, whereby the citizens of the country could get that insulin, was now destroyed. And so everything about supplying insulin to patients within Syria was obliterated fairly early in the conflict, which meant that for actually many medications, but particularly insulin, those diabetics in the country were completely dependent on sources outside the country. And in a country of about 17 million people, you figure the incidence of diabetes is about 10% in populations in that area. You're talking about over 1 million people.
Yeah. I want to go back to that conversation and something that you said. So there you are, you're in the car, so now you have this problem and you get to work and now you're going to solve it. What was step one? Were you in danger of driving off the road? Were there things written on napkins? What was going through your mind and then some of the first steps?
Well, I didn't tell Ihsan this, but often when I get in conversations. I'm very animated. I actually do have trouble paying attention, and I miss exits, etc. So you hit a
So you
sore
didn't
spot.
tell the passenger.
But we're here. It's funny because I think like any project where you've got two people that get together that need to know each other, there's coming to understand the different backgrounds and how we work together. And then there's coming to understand the problem. Mm-hmm. And I think when we began, I think we both had some ideas, some very grand ideas about how we would approach this. And this was in May, by the way, the middle of May in this past year. And we also, at the outset, sort of talked about how we could do this on our own. It's sort of totally ignoring all the things of, well, how are you going to get money? You have to do fundraising. Right. He's a physician, I'm a biochemist. We're not exactly, right, gifted salespeople. So I think the conversation in the car was very animated, and we committed to getting in touch with each other. But then I think events played out over the coming weeks. And I think one of the great things was when Ihsan made contact with the Syrian American Medical Society. And maybe you should talk about that. Yeah. Because that really, I think, was the thing that allowed a lot to coalesce.
Well, that's the thing. I mean, you actually followed through. There's a million people who have that conversation in the car and who say, we're going to get together and we can do something and we can make something happen. Awesome. I mean, to me, I mean, there's a million people who think, I can do something like enjoying good. There's very few people, 3 of them are sitting here, who actually then follow through and make a difference. So, okay, so pick up the
very good question, like how we, so, I have a family member who have, from my extended family who have diabetes, so it's like something touching me personally. And Rick was like very enthusiastic, to help out in this. So the first step was collecting data. So first we thought about,
very engineering minded.
Yeah. I mean, thought we're going to bring inhaled insulin because we thought this is the problem. So we need like, something can sustain in difficult conditions, like if we don't have refrigerators. So I used my connection back in Syria and like some people working in Turkey, and they said, no, this was in the past, like a couple of years ago. Now we don't have insulin at all. We have like generators to save insulin, but we don't have insulin. So we kind of shifted the gear, and we decided to start from the very beginning and like, to do the insulin. So then we looked where we're going like to start, and then we said to ourselves, okay, if we're going to start this as a fundraising campaign and starting from zero, that's going to take us a lot of time, and there are a lot of people who are dying out there in Syria, so we need like, to do something very quick. And then like we brainstorm what we do. Then we thought about contacting Syrian American Medical Society, and there we contacted actually the president of SAMS, who's based here in Massachusetts, and since then we launched the
I just want to interject and just talk about how all of us are connected. And one of the people that I had pointed both of you to contact was Dr. Amjad Banasi, our first guest for this show. Because he's also part of Syrian American Medical Society. And when we were talking and they were taking this initiative and came to me and said, do you know people? The first person I thought of was him. And that's how it progressed. So talk about connections.
Yeah, no,
making
absolutely.
Connections.
And so you're making these connections. All right, so now SAMS is involved. They're obviously they're on board and want to help. How did they help? What then is the next step?
So, I mean, they have their own clinics. They have people working in Turkey. We're now organizing and managing things, and Rick will talk more about it, probably because, he put a lot of efforts in that. So then, like, we have some points and some people working in Turkey, and they deliver it back there to Syria. And Rick can talk about the good work, here in the U.S.
So just to jump back a half step, you asked about, sort of how does one get the wherewithal? Why does one person out of thousands do this?
Yeah.
And I do have to confess to having one certain advantage, along with my pharmaceutical industry experience. I had actually left the industry in 2008 to pursue other things, and among them, trying to find other ways that the pharmaceutical industry, medical research could be applied for greater social responsibility than the for-profit sector does it. So I had the time, I had the motivation, so there was also that factor. So to me, this in effect became a full-time job, although we're both doing this on a volunteer basis, I should point out.
Right.
So yeah, I think one of the big things that SAMS introduced us to, as Ihsan mentioned, was they introduced us to a pre-existing network that does things, does healthcare. It's not just the physicians, but they also are responsible for procuring and delivering their medications there as well as having people that are experts in the field to sort of fill us in on what the needs are. They did help us refine our goal. We went from the goal of treating millions of people to get it at the outset down to treating the number of patients that they were currently seeing. At the end of the day, as we're looking at it, this problem is really a problem of what we call supply chain. So if you watch a lot of things about war zones and medical treatment there's the incredible courageous work that the physicians do. There is also this whole chain that has to get the medical supplies and medications to them to do their job as well that you don't generally hear about. In this case, SAMS has actually built, I think,
very good
again, an impressive supply chain. Just to give you one little statistical example. They have a 100% success rate over the year 2017 of getting medications from their central facility, which is in Turkey, getting them to the clinics at the hospitals in Syria. This is in a war zone. And every one of their shipments of medications made it. Now this helps that it's a Syrian-based organization. They have connections in the country. They know how to get things places.
Right. But you still have the same problem. I mean, so even though you can have it in Turkey, or even though you can put it in the trucks or whatever, you still have the refrigeration. You still have the electricity when you get there. So don't you still have the same problem that you encountered to begin with?
So nowadays they have like generators again in the hospital, so they can fridge or like they can put the insulin in the refrigerators, and in the trucks itself they have refrigerators, so they can move it, transfer it from place to another.
And one of the things that was really valuable when we first started was those folks who were in charge of the logistics had actually done a survey, or were planning on doing a survey of the clinics there. And we knew which clinics had electricity on a fairly reliable basis, which ones had generators. And it turns out actually only about half of the clinics in the area that we were starting out to serve had electricity. And so those clinics, actually, we could not do that. Now, fortunately, that doesn't mean you can't treat diabetics at all, because about half of diabetics can actually manage their blood glucose with just pills. There's a drug called metformin and another class of drugs called sulfonylureas. Those don't need refrigeration. And so as part of our project, we said we're not just going to try to get the insulin there. We can also reach a lot of people that are in some of these clinics without refrigeration by getting these other pill medications there. So we're able to get at least some level of coverage in these areas. But again, like I say, I think the bottom line and the most important thing that I think SAMS has really done well, and it deserves to be recognized, is getting that logistical chain in place that works under unimaginable circumstances to do this, and is able to produce the kind of data like how their clinics function, where they're located, so that then folks like us on the outside, when we go to talk to people and solicit donations of medicines, we can say this is exactly what we need, here's the shipping information and all that. It was quite an advantage.
Can you tell us about your involvement now then? You said you're still volunteering. And you talked about how SAMS, the infrastructure is set up and what they're already doing, but how are you both now working with SAMS?
Well, I think one of the things that I think has been interesting and good has been that SAMS is an organization which is founded and run primarily by physicians working in the field. They are growing their business expertise. And I guess one of the other, at the risk of sounding presumptuous, one of the things I was able to bring to this was some business savvy from my pharmaceutical days in business negotiations and some of the things that needed to be done in order to get these drugs. Because again, what we wanted to do was take the route of going to the pharmaceutical companies directly and asking them to donate these medications. This was a fairly new approach. This is not a common approach in the nonprofit world in general. So that's a very long way of saying that I think we've had a fair degree of autonomy And in fact, I think our relationship with SAMS is, while we talk with them regularly, I think they're also watching us to see how this model works out. So I think just to sort of sum up how it's been over the past year.
It's very important to talk about the outcome.
Yeah, so as a result of our efforts this year, we were able to secure about $300,000 worth of drugs, market value in the U.S., donated by a major pharmaceutical company. I can't reveal that at this moment, that are actually en route to our facilities in Turkey and will be en route to the clinics there. And those are medications, the oral medications for diabetes, as well as medications to treat other conditions that often accompany diabetes, certain types of infections and things like that. The bottom line is it's a nice start.
Right.
Compared to the scope of the problem. If I had to guess, I would say this past year we've knocked off about somewhere between 3 and 5%
Right.
of the actual need that needs to get met.
But I think it's still very commendable. As they say, you know, saving one starfish at a time with that proverb. So it's still very commendable. Yes, there's a lot more room to grow and a room for many people who are listening and who are watching to come and join this effort and donate and maybe help as much as they can. So do you want to share some of the information of where people can donate and help and
well, absolutely.
find more information about this particular organization?
So yeah, I mean there are different ways. Besides, you know, talking directly to pharmaceutical company, we did a couple of you know, fundraising events during Ramadan, and we raised some funds. Also, we raised awareness. But like for the purpose of the people who are interested to help in that, they can go directly to SAM's website, and there is a donate button, and they can go for that, and they can donate. And there is a field they can mention. It's for the diabetic Care for Syria project.
And Ed, can I give the web address?
Yes, please.
Yeah, so that web address is fairly simple. It's www.sams-usa.net. And as Ihsan said, it's a very simple website to use. And you'll actually find out a little more background information about our Diabetes Care for Syria project on one of the pages there.
While this effort is going on, what is the long-term outlook in Syria? You talked about how pre-war, obviously, insulin made right there in Syria and being able to be distributed freely to people. Is that day coming, again, not in the short term, but maybe in the long run?
I mean, it's going to take time. Health system strengthening, and, you know, rebuilding, actually. It's not only strengthening, because a lot of hospitals and infrastructure were destroyed. So rebuild the health system is going to take time. Insulin, providing insulin and diabetic care in general in Syria is going to take time. But hopefully when things, I mean, the most important thing is the security. When you solve this issue in Syria and you get the security back to Syria, then everything is going to take a little bit of time, but like you see hope. The most important again is the security. So we really think that the Syrian people are capable actually to work. I just heard recently that the pharmaceutical company was or used to provide or produce insulin in Syria. They were able now, or they started, you know, to produce insulin again. I'm not sure about those information. We need to check them, but I mean that's very possible.
That would be some good news.
Yeah.
Right.
Yes, and I do, just to give another little perspective on this, because I think we hear so much about medical relief in disaster situations. And one thing that's very important to understand about the Syria situation, say in contrast to a Hurricane Irma or et cetera, is those are things that happen, a single specific event happens, and then you clear it up and you go away. This is a situation where SAMS has had to basically construct an entire standing hospital unit to build, maybe not quite a Mass General, but let's say a St. Vincent's Hospital, build hospitals throughout the country and then keep them going. And that need, because the infrastructure has been so destroyed, the need for those clinics is going to persist, not for weeks, not for months, for years.
Right.
And they will need to be supplied just like your local hospital needs to be supplied here. So You know, I think some people think, oh gosh, there's peace in Syria. God willing, there will be.
Yeah.
But the rebuilding is going to take,
Absolutely.
I think, years.
Yeah.
Also, the human resources is a very big issue. Also, human resources for health in Syria. Yeah.
Yeah, to
So
be able
going
to
back
use.
to the statistics that you had mentioned, that the amount that you raised and the medicine that's en route is only 3 to 5% of the problem. So when you say 3 to 5%, is that the percent that you're claiming just for a month out of the, what's the total in terms of time? What is that 100% that you're comparing to?
So that 100%, the way that I framed this and I was laying this out, was how much of those medications would it take to meet the needs of all of the patients that are served by a SAMS clinic in Syria. Now there's some geographical
For how
complexities.
long?
For 1 year.
For 1
To
year.
generate a 1-year supply of that. The 100% is a huge number.
Right.
3 to 5% is still quite
Well, I was just
big.
trying to make sure that my, base that you were talking
Yeah.
about, was it 1 day that
No.
you're talking about versus 1 year? What was that 3% represent?
It's if honestly, and this is the way so much medical relief works, you do go in and you give them a shot of something, but in a month or two it's gone.
Right.
And I think, I hesitate to use the word cruelty, but there is kind of a cruelty to that. The patients get it, but then they can't rely on it. And so I think our objective is, no, to have something that will last a while. And by the way, I do want to say just one other thing. The 3 to 5% is one number that's important, but I don't want people to get stuck on that. I think we also did something incredibly important. We built relationships with some of the largest pharmaceutical companies in the world, with the World Health Organization. We've developed relationships now that will allow SAM's excellent logistical network to tie into our contributions. Those things don't go into that total. But those are the things we don't have to do again. Right. So that in the coming year, we're optimistic.
I mean, those are sustainable connection. We can depend upon, starting a project, it's always difficult in the beginning, and you don't really expect outcome to come right away from that. But as Rick said, like, we build this connection with WHO, different entities, pharmaceutical company, to go faster, in the future and respond to that properly in the future.
This is one of the fastest perspectives ever, and I'm afraid that we are just out of time, just enough for you to talk a little bit for about 10 seconds about what we learned today.
Well, the greatest thing to take away from today is a lot of people believe that things just don't happen. It's not by coincidence. Sometimes, it is planned and ordained. And this meeting of these two people and my fear, and I'm glad I went against my fear of calling Dr. Rick Wobbe to take Dr. Ihsan for an interview. Really just two people meeting and what kind of benefit that they have brought to the world. And last I wanted to just mention before we leave is, even though they have started and are now on their path to success, remember please that people who have these medical issues in these war-torn countries, they constantly need the medical help, and if they just get medicine for once does not mean they are good for life. It is something we need to kind of talk about how often they need it again and continue to help them. So thank you for watching, and hopefully you'll watch us again next week.